Welcome to Guide Mia. Today we're going to talk about reviewing and approving the treatment plan your doctor shared with you. This one is a patient guide, written for you, not for a medical audience. When your doctor shares a plan on Cympha, you get an email with a link, and behind that link is a page built to help you make a real decision, the plan itself, in plain language, any pictures your doctor attached, and simple buttons to respond. By the end of this short video you'll know what each section of the plan means, the 2 ways to respond, how the private chat with your doctor works, and what happens if the plan changes later. Follow along with your plan open, or just listen now and read it later, there's no rush. Getting in takes a minute. Click the link in the email from your doctor. If you don't already have a Cympha account, you'll be invited to create one, just an email and a password, no extra steps, no forms about your address or history, your doctor's office already has all of that. Then you land on a page titled Your Treatment Plan. At the top you'll see the patient name, that's you, and when your doctor shared it. Below that, the plan itself, section by section, then any pictures your doctor attached, and at the bottom, the buttons you'll use to respond. That's the whole geography of the page. If you'd like a slower walkthrough of the account setup itself, there's a separate short video just for that. Today we're focusing on the plan. Now the plan itself. It's written for you, not for a medical record, plain language, no jargon wall. Exactly how it's organized depends on your consultation, but you'll typically see these sections, in this order. Your concern, what brought you in your own words, so you can check your doctor heard you right. What we found, the findings from your exam. Your treatment options, the real choices in front of you, and yes, that includes the option of doing nothing. A good plan tells you what happens then, too. Recommended treatment, the option your doctor suggests, along with the reasoning, not just the verdict. Then risks, what could go wrong or limit the result, next steps, and finally the approval and questions section, which is your turn to speak. Take your time with each one. This page isn't going anywhere. 2 things people look for right away. First, cost, and you won't find it here, on purpose. Cost is not part of the plan document. Your doctor's office will discuss cost and payment options with you separately, by phone, by email, or at your next visit. That's deliberate. This page is for understanding the treatment itself, and the money conversation happens where it can be a real conversation. Second, pictures. If your doctor attached photos, pictures of your teeth, X-ray images, before and after references, they appear in a section called Pictures Your Doctor Shared. Tap any of them to see it full size. It's worth doing. The plan often makes much more sense when you can see the thing it's describing. When you've read the plan, you have 2 ways to respond, and both live at the bottom of the page. If you've read and understood it and you want to go ahead, tap the Approve button. Your doctor is notified, and your approval is recorded on your case. And that's genuinely it. You don't print anything, you don't sign anything, there's no paperwork coming in the mail. If instead something needs clarifying before you decide, use the questions option. Type your question into the text box and send it. It lands on your doctor's case page and shows up in their chat with you, and they'll respond once they've read it. There's no wrong choice here, and no timer running. A question is just as good a response as an approval. Your doctor would much rather hear the question. Below the buttons there's one more section, Chat with your doctor. This is an open-ended conversation thread, and it's there for everything that doesn't fit a formal button. Follow-up questions after you've had a night to think. Practical things, scheduling, what recovery looks like, whether you can still play the trumpet. Anything on your mind. And here's the part one want you to hear clearly, because people worry about it, this chat is only between you and your doctor. If a dental lab ends up making something for your treatment, that lab does not see this conversation, nobody does, except the doctor. So ask the awkward questions. That's what the thread is for. Sometimes the plan changes after you've already approved it or asked your questions, new information comes in, or your own question surfaces something worth adjusting. That's normal, and here's how it works. Your doctor updates the plan and reshares it, and you get another email with a link, just like the first time. When that happens, read the latest version before making your decision. Don't rely on what you remember from the earlier one, because the details may have moved. And if anything about the update is unclear, why did this change? What does this new part mean? That's exactly what the chat is for. Ask, and decide when you're sure. 3 final things. First, caregivers. If you're reviewing on behalf of a child, a parent, or a patient who can't review for themselves, the doctor should have shared the plan with your email, the caregivers. You then approve or ask questions on their behalf. Your doctor knows you're the responsible adult on the share. If a plan lands with you that isn't for someone in your care, contact the practice immediately so the share can be corrected. Second, privacy. Your plan is visible to exactly two people, you, the holder of the shared email, and your doctor. The lab that may eventually make a restoration doesn't see this plan. They get a separate, lab-formatted case if your doctor sends one, and no other practice or patient ever sees it. Third, keeping a copy. Every section is plain text, so your phone or browser's save as PDF or print function works fine, and the plan stays available on Cympha as long as your share is active. So here's the whole thing in one breath. Open the link, read each section at your own pace, look at the pictures, and then either tap approve or ask a question, and use the chat for everything in between. Nothing about this page is trying to rush you. The plan waits for you, the conversation stays private between you and your doctor, and there's no paperwork at the end. An approval is one tap, and a question is just as welcome. If the plan changes later, you'll get a fresh email, and the newest version is always the one to read. Your treatment is a decision you're part of, not something that happens to you, and this page is where you take part. The written version of everything you just heard is at cympha.com. Choose Docs and open reviewing and approving your treatment plan. There are more short patient guides in this series, including how to open your plan for the first time. We're walking through every Cympha workflow, one lecture at a time, so subscribe if that's useful to you. Thanks for watching, and be well.